although it looks very simple, like in pharmacoeconomic analysis, just to compare two different treatments and come up with the best treatment option. But here, taking wise decision is very important. We have different analyses, different perspectives, and different types of cost and consequences which are involved in this analysis. So every pharmacist, they have to know about these priorities, what is most important in taking the decisions. And that why, as I said, we need to take wise decisions. We have wide variety of options for the treatment of different diseases. And we need to develop the strategies to select what are the important criteria to take the decision against any diseases. Okay. And as I said, that we have different medications, and we need to find out which is the most cost-effective treatment in those diseases. The content of my today's slide is I would like to discuss about the clinical pharmacy profession and their role in analyzing pharmacoeconomic analysis. And I would like to show some pharmacoeconomic analysis with some evidence and with some examples, the benefits of the pharmacoeconomic analysis. And then finally, I'll conclude with one slide. Starting with the profession, as everyone, they have seen the drastic transformation in the pharmacy profession from apothecary to clinical pharmacist. And although they were doing the dispensing of medication or preparation of the medications, but now they are working with advanced degree in clinical pharmacy. They are working in a healthcare team. And because of the different drug-related problems and medication errors, it is a major issue in healthcare systems. So we need some mediator to identify these drug-related problems and mediate between patients and physician, other healthcare providers. Since pharmacists are the expertise to detect, resolve, and prevent these medication errors, so the preference is given for the pharmacists with some advanced degree in clinical pharmacist. And as we have seen the development of these clinical pharmacy practice in recent decades, and it has resulted in increased number of pharmacists working in clinically advanced roles worldwide. And we have seen different added responsibilities for the clinical pharmacist when they are working in healthcare team. They need to know about the differential diagnosis and selecting the appropriate medication for that. And while selecting these appropriate medications, they have to even see that whether it is affordable by the patient. Although there is an insurance, but what they are paying out of the pocket. And not all the for all the diseases they have insurance is covered for those treatments. So we need to do some pharmacoeconomic analysis so that the patient can have some affordable medication, the best affordable medication. So here the pharmacies, they ensure the rational and cost-effective use of medications and promote healthy living. They increase the positive clinical outcomes by actively engaging in the patient care activities while collaborating with different healthcare providers. And of course, the roles are expanding, the duties have been increased, and we need to be expertise in different fields so that we can have some definite outcome in the patient and can provide individualized treatment for every patient. And when you talk about the pharmacoeconomics, so these healthcare costs, it is rising worldwide due to the new medications in the market and new pharmacotherapies with different technological advances. And with this rising cost, there is a pressure for the healthcare organization to identify and implement the cost control measures. So we need to identify what are the different analyses we can able to do to control the cost. So these pharmacoeconomics, it deals with the best and economical alternatives of expensive therapies, and it helps to take the wise decision or the right decision about the rational use of the medication. And therefore, it is a role of the pharmacist in advising on the medicine expenditure and ensure there is economical use of the medicines. Because sometimes when we are comparing two different medications, we feel that for a short-term use, we feel that, okay, drug A is the most economical. But when you see the long-term roles in the treatment of those diseases, there might be exacerbation, there might be rehospitalization, there might be some emergency, which increase the overall cost. So we need to see all the all possible areas and ensure the economical use of the medicine. I will try to show some examples with the basic pharmacoeconomic analysis. Because nowadays, everywhere you can see the cost cutting effect, even in the supply of the medication or use of the medication, starting with the drug development till it is used by the patient. In every step, there is the importance of the pharmacoeconomics. They are utilizing the different strategies to minimize the cost effectiveness or minimize the healthcare cost, starting with the drug development or drug testing or regulatory process or marketing, distribution, dispensing, patient use. Every step, there is a use of the pharmacoeconomic analysis. So we need to know the basics of pharmacoeconomic analysis. As I said, doesn't look simple as it sounds, because there are different perspectives. We need to decide what perspectives we have to apply, what different types of cost based on the perspectives, and what consequences you are expecting based on the different analysis, whether it is a cost minimized analysis, cost benefit, cost effective, or cost utility analysis. So these are the different perspectives, whether you're doing for the patient, you're doing for the providers, you're doing for the payers, the insurance company, or working for the whole society. So depending on these perspectives, we can select specific cost. So we cannot take all the cost in all the perspectives, like payers perspective. In payers perspective, we have to take only the direct cost. For the patient and societal perspective, you can take the different types of cost, whichever is eligible for those analyses, and also depends upon the what type of consequences you are expecting, whether it is just economical consequences, you can go for cost minimization analysis. Clinical, you can go for cost effective analysis. Humanistic outcome, you can go for cost utility analysis. So these are some of the strategies you need to develop before doing pharmacoeconomic analysis. Select which perspective you are doing, and according to those perspective, what types of cost and what types of consequences you are expecting, and you can select the right pharmacoeconomic analysis. So these are the basic pharmacoeconomic analysis. Let me discuss one by one with some evidence-based examples and showing the benefits of using pharmacoeconomic analysis. Let me start with cost minimization analysis. So in the cost minimization analysis, just we are comparing the cost without calculating the outcome. Because here to conduct these analysis, we need to have evidence that two different outcomes have same outcome. Then we can do the comparison of the cost. And regarding the comparison of the cost, for example, if any clinical pharmacist has given a task to compare two different drugs, and they have to do on the provider's perspective. So if it is a provider's perspective, only direct cost is measured. So here we have to know that when you're comparing two different drugs, so we have to know about the cost of the drug, we have to know about the cost of preparation of the drug, and we have to know about the cost of administration, which gives the overall cost comparison of two different drugs. For example, the cost of drug A is just an example. I'm giving some numbers like 10 dirham for cost of drug, and preparation cost is 2 dirham, and administration cost is 3 dirham. So overall, it'd be about 15 dirham for drug A then. And it's a new drug like drug B, the cost of drug, it might be 20 dirham, and cost of preparation is 2 dirham, and administration is 3 dirham. So here it is about 25 dirham. When you look the cost, it feels like drug A is more economical when compared to the drug B. But we have to see about the duration and frequency of the drug. For example, drug A, so the duration is different from the drug B. So for example, it is given 3 times a day. So the overall cost is 45 dirham. And treatment, it is used for 7 days. So we have to calculate for 7 days, that is about 315 dirham. So whereas drug A, it is given once daily. So once daily, the per day cost is only 25 dirham. And even though the duration is increased for 10 days, still the cost, overall cost, it comes about 250 dirham. So here we can see that when you calculate the two different drugs, there is a huge difference between the cost of the drug and overall cost of the drug. And after the analysis, we can say that the most cost minimized drug is drug B, where 65 dirham less when compared to the current antibiotic use. So likewise, we can do the wise comparison, take the wise decision, not just by seeing the cost of the medication, but overall cost of the medication by seeing the duration and frequencies. And here one more advantage, for example, if using antibiotics, again, there is a huge difference between when you're using oral antibiotic and when you're using the IV antibiotic. Although IV antibiotic is expensive, so you can see that it depends upon the how much, what is the duration, what is the frequency. And again, the cost of preparation for oral, there is no cost of preparation. Directly, it is orally administered. But the cost of preparation for IV, it is increased. So we need to look into these factors when you're comparing two different drugs and not just by seeing the price of the drug on the strips. So we have to see the duration, we have to see the preparation time, administration cost, and then even we have to see the frequency and duration. This is another example, the research done in Dubai Pharmacy College by undergraduate students. They have seen, they have analyzed the contraceptive methods used among the women in UAE, and they have successfully they identified which is the most cost-effective oral contraceptive methods. And the next one is about the cost-effective analysis. In cost-effective analysis, of course, we need to see the cost and outcome, that is the cost and consequences. And if it is cost-effective analysis, of course, the input is the cost and output is the clinical outcomes. Definitely, we have to see the positive clinical outcomes. When you are comparing two different treatments, we have to see that which drug gives more positive clinical outcomes and less risk associated with the treatment. And while doing this comparison, sometimes you may feel that the drug A is the best one with the most economical, but it may give the short-term benefits. But we have to see the what are the long-term benefits, especially for the chronic diseases. So when you see the long-term benefits, there might, as I have mentioned earlier, there might be exacerbation of the disease, there might be emergency visit, there might be rehospitalization, there might be relapses of the disease, there might be unpaid leaves. Again, indirectly, it increases the overall cost of the medications. So we should not just depend on the short-term benefits. I'll give one example with one of the publications for the cost-effective analysis. It was done in Greece, where they have added the biological drug omalizumab in the treatment of severe allergic asthma in the patients. Of course, there they have the insurance, the government insurance. It is a free medication, and that's the reason they have done based on the societal perspective that how much government is spending on the treatment of asthma patients in the Greece. They have taken they analyzed the clinical trial and real life data, and they compare the standard therapy. So of course, in the standard therapy, we have the short acting, long acting inhalers and inhaled corticosteroids and anti-leukotrienes like melanoxide sodium. So they are adding step by step that based on the severity of the patient, they will add step by step therapy. And this is the standard therapy. And government is spending a lot on this standard therapy. Uh, Even after giving this standard therapy, again, there are a lot of rehospitalization, emergencies, which I find out, which has increased the overall cost of the therapy asthma patients. And they have done some clinical trials and taken the real life data by addition of biological drug. Of course, the biological drug is very expensive when compared to the standard therapy. When you add this biological drug with the standard therapy, definitely it is increasing the overall cost. Almost it is double that come in treating the asthma patients. But when you see the long-term benefit, as I've mentioned earlier, we have to see about the exacerbation, we have to see about the emergency visits, we have to see about the rehospitalization, relapses, and the leave, the unpaid leaves, what are they having that. So here with these long-term benefits, definitely they have noticed a reduced overall cost. The emergencies have been reduced, relapses has been reduced, and even the unpaid leave that in the standard therapy, repeatedly they have to take the leaves. Like in fact, they are, it is like they are losing the money that because they are not getting the appropriate salary because of the unpaid leave. So here that they can save, which can reduce the overall cost of the therapy. So even they have the patient's perspective, there is a good benefit, and societal perspective, there is a good benefit when they add the biological drug with the standard therapy. So this is the real life data. I cannot able to produce all the results. They have a big analysis on these clinical trials and real life data with short description, as I have mentioned, that it has reduced the overall cost, even though they have added the biological drug.
Professor, I think we have 2 more minutes. So
Yeah, sure. I'll try to complete it. That, sure. And we have another example about the cost-effective analysis of hepatitis treatment. Our students, they have collected the data from Egypt, and they have come up with the best outcome, best drug. And we did drug-gene interaction therapy, and we have find out what is the best outcome for this pharmacogenomic study. And next one is the cost utility. That here again in the cost utility, we are using some common common outcome, that is the quality quality, what we call as quality adjusted life in years, where we'll see that it is a common thing, even though there are different interventions like medication, they have different benefits, screening, they have different benefits, kidney transplant, they have different benefits, but by measuring one outcome, that is the quality adjusted life in years, we can able to find out what is the best intervention we can able to get it. Here we will assess the quality by quality of life and number of years they have gained, like how long they have lived even after the treatment, and what was the quality of life. And every intervention doesn't have the same number of years they have lived or same quality of life. So when you find out these quality by multiplying number of years gained and quality of life, it gives the best outcome, which says that how much cost they have involved in measuring these things. So again, involvement of this quality, it is good. Like 0 is the death, and 100% good quality of life is 1. That, of course, I like to skip this thing. I have just a few minutes. One important thing I like to highlight over here is multiple decision critical analysis, that where sometimes we have a lot of options, and every intervention we see there is a benefit, but we'll be confused that how we can select the best medication. I'll give one with the best example over here. Like for example, in the selection of bananas, so if you need a banana, so we have different options in selecting the bananas. Like we have the best banana with 455 AD per kg, or 420 or 370, or we have cheapest drug like 290 or 220. So when we are taking the decisions, if we go for the cheapest one, so it is too old, it will be moldy, it is a bad quality. We cannot go for the cheapest drug. And another cheapest drug, it is very small and it is different in taste. And of course, it is based on the preference. Some they like that. And when you see the expensive, it is very expensive. And the average drug is, it is good, but it has short life. So all these are the different criterias, and we will be confused that how we can select the best bananas. So here comes about the multiple criteria decision analysis. So here, by applying the multiple criteria decision analysis, we can able to select the best product from here over here. So here, how we are doing is like we are having some defined objectives, like what is the preference. So what is your preference? So what gives the best value for the money? By defining those criteria, depending upon the price, depending upon the smell, depending upon the origin, depending upon the shelf life, cost, and qualities. And then we are giving certain weightage for these different criterias, and then we can take the multiple criteria decision analysis. For example, if we are giving a different weightage for the different criterias over here, and when you compare these five different bananas, so you can use certain ratings over here, and we can identify with these ratings, we can identify based on the weightage, we can identify which product is best for your, based on your preference. So here, when you calculate all those criteria, we can find out that the banana C, that which has the best scoring, is most cost reduced product with without any compromising and having a better benefit. So likewise, we can apply a similar criteria even for selecting the medication. Of course, we feel that how you're comparing with these the medications, but of course there are some relevance based on taking certain decisions. It is very similar. Even we can develop certain criteria when you're selecting the medications, which can get the best outcome and improves the patient health and safety and have the better access for it. For example, for the criteria for selecting the medications, we can find out what is the product, whether it is the most cost effective, what is the technology used, and who is the manufacturer, whether there is a good clinical practice or manufacturing practice, and about the supply, about the microeconomic benefit, about the availability in the local market, and other services, whether they are providing pharmacovigilance services, whether it is a cost effective, and whether it is they are having certain better patient health outcomes or not. By having these multiple criteria, we can able to decide which product has most cost effective outcome. Okay, so this is about one of the best analysis we can able to implement in the drug procurement, formulary listing, reimbursement, and pricing. We have other services, other publications, like nowadays we're having many systemic reviews about the cost effect analysis in the treatment of asthma and the treatment of multiple sclerosis. These are some of the best evidences we can able to use in taking the decisions. So with this, I will like to conclude that, of course, there are a lot of demonstration that how pharmacists can contribute in reducing the cost in wide variety of the healthcare settings. But still, we need more new technologies, more new study designs, and further studies are required to have a greater value to endorse the benefits of the pharmacoeconomics. And of course, high quality studies of this nature will definitely, it helps in taking the wise decisions in rationalizing the medications. That's all for this today's talk. And with this, I thanks everyone. Of course, it was very quick, just in 20 minutes. I tried my best to show the importance of pharmacoeconomic analysis and its impacts on the patient care.
Thank you,
Thank you,
Professor.
everyone.
Very nice, excellent talk, Professor. We were able to understand how economics can be used in our pharmacy profession and improve patient care. Thank you, Professor. Now I think it's the time to hand over to Professor Samra. I think she will now chair the session for the next